How's everybody today? We were just talking about the hero pay, the $2 million. Have you guys heard anything on that? Not yet. Us either.
I'll pop a link in the chat for what I saw.
That would be great. We are recording again, just a little heads up on that. Is anybody from Leading Age on at this point? Not yet. They're doing some really cool things. I don't know if any of you follow them on LinkedIn, but they have some pretty cool things that they're doing and marketing right now to really ask for more pay and assistance in the healthcare and elderly field. Do we have any senior care on yet at this point?
Nicole's here. I don't know if you can hear me.
Hi, Nicole.
Yeah, hi, Nicole.
Hi.
How are you?
Good. How are you?
Good. Brent, I met with a couple people yesterday from Centricare, Mahado, Ali, and Patrick. Just talking about their work. They're doing some really super cool things in their department, and they work in diversity and inclusion. One's more internal, one's more external, which is really cool. I don't know, do you want to talk a little bit about what they're doing or what some of their work is at all, Brent?
Yeah, happy to. And there's a third member of our team that's exclusively focused on diversity and just joined us about a month ago. And her focus is solely on further diversifying the incoming talent of the organization and really focusing on those recruitment pipelines and partnerships in our communities that we can develop and grow to increase that talent pool. And then some of those new additions to our D&I team are really focusing not only on the community outreach that can certainly help with diversifying our talent pool, but can also help with things like health disparities and knowing how to access the health system, but also focusing on the employee experience within Centricare to make sure that we don't create just a faster revolving door for talent, but that we're developing relationships, mining and cultivating talent externally to grow and thrive within the organization. So really taking a holistic approach and investing in some of those resources.
Yeah, and I found it really cool, Brent, too, that they were talking about the community health workers that are located even in rural areas outside of the St. Cloud area, focusing on Hispanic as well as Somali, their cultures, their religion, any type of assistance that they need. So I thought that was pretty cool, too.
Yeah, we found the partnership with those community health workers is great for recruitment too, right? Because they're already plugged into the diverse aspects of our community and talk about many other types of healthcare challenges. So they already have the inroads, the relationships, and so from a recruitment side to partner with them has produced some great results.
Yeah, and then Mahado was telling me that they're in St. Cloud, and I never even knew this myself, that there's a Somali professional network group. So I found that really cool as well, that they're helping each other and within their communities, not only as professionals, but then they're also helping the job seekers. So just helping connect those dots, which is really, really cool.
Yeah, agreed.
Great work, Brent.
Thank you.
We're going to go ahead and get started. We'll do a real quick introduction. If you can just say where you're, who you are and where you're from. We'll start with myself. Hi, I'm Della Ludwig. I am a workforce strategy consultant for Central Minnesota, and I am leading this group. Can you make sure that you're muted until you're speaking?
Sounds good. Thank you.
You're welcome.
There's a couple people that aren't on mute. Thank you. All right, we're going to go ahead and get started. Jessica, do you want to go ahead and do an introduction?
Yep. Hi, everybody. I'm the workforce strategy consultant for Southern Minnesota. I see some familiar faces here, which is always fun. And I'm co-leading this with Della, and then I'm going to shift it over to our colleague, Sean.
Hey everybody, this is my first meeting with you, but I'm Sean Husky. I'm the Workforce Strategy Consultant for Northeast Minnesota, a counterpart to both Jessica and Della.
And Cindy? Cindy, I don't know if you're frozen. I'm going to skip to Brent.
Hi, good morning. Brent Bultema, Senior Director of Talent Solutions for Centricare, and I'm located in St. Cloud.
Excellent. And Nicole Matson.
Hi, I'm Nicole Matson with Care Providers in Minnesota, and we're a state association of long-term care providers.
Wonderful. Colleen Brickle.
There we go. Good morning. I'm Colleen Brickle, Dean of Health Sciences at Normandale Community College.
Welcome. Sherry Hutchinson.
Good morning. I'm Sherry Hutchinson. I'm the Academic Program Director. I do program approvals for all 37 of the colleges and universities.
Wonderful. Cindy Beskai.
Hi there. I'm having some internet problems, so I apologize. I am the Vice President of Talent Management for Essentia Health. I'm remote working out of Milwaukee area.
Thank you. Nathaniel Sweet.
Hello, I'm Nathaniel Sweet. I'm the Director of Talent Acquisitions for Essentia Health, and I am also remote working out of Tulsa, Oklahoma.
Welcome.
Thank you.
Carrie Matson.
Hi, I'm Carrie Matson. I work with the Department of Human Services for the state of Minnesota. Also working remotely in the great world of Hinckley, Minnesota. Not as cool,
Awesome.
but
It's
so
my
cool.
region. Sarah Behrens.
Good morning. My name is Sarah Behrens. I'm the coordinator of school and industry.
Oh, we lost you a little bit, Sarah. You want to try one more time, Sarah?
For Northwest Technical College in Bemidji, Minnesota.
Great, thank you. Deb Barnes.
Yeah. There we go. Hi. Yeah, Deb Barnes. I am the chair of the South Central Workforce Council, and I'm also the CEO of Lakeview Methodist Health Services in Fairmont, and I'm a consultant for Oak Terrace facilities, Gaylord, Mankato, Le Sueur, and Jordan.
Wonderful. Jenny from Good Shepherd.
Hi, I'm Jenny Sutliff, the employment recruiter with Good Shepherd in Sauk Rapids.
Wonderful. Katie Mortensen.
Hello, I'm Katie Mortensen. I'm a regional healthcare preparedness coordinator for the Southeast Minnesota Disaster Health Coalition.
Wonderful. And of course, now my name's got all out of order. Shayla.
Hi, I'm Shayla Drake. I am with the Career Force Center out of Duluth, and I'm a workforce consultant.
Excellent. Paul Stefan.
Hi, this is Paul Stefan, and I am a talent acquisition manager working with Alina. I do work remotely, but from not very far away in my home in Plymouth.
Wonderful. Taylor McCormick.
Good morning. My name is Taylor McCormick, and I am a senior recruiter with St. Luke's Hospital in Duluth, and I am on site on campus in Duluth.
Excellent. Have I forgotten anybody? If I did, I apologize. Again, welcome everybody. We've met one other time so far and just really want to dig into the workforce in healthcare. Have quite a few leaders here on the committee, everything from executives at healthcare and long-term care, as well as within our school systems and colleges. So lots of good energy and really looking forward to how we can move forward and make a change. With that, I think what we're going to do is start pulling up a couple of our past Padlets that we had worked from. I don't know, Jessica, if you have that available.
I do. I'll pop in a couple links, but then I'll also share my screen so we can view it together. So the first one we're going to talk about is just to review the current concerns in healthcare industry. Because after our meeting last time, many of you continued to add to these Padlets, which was super fun to see. So I'm going to share my screen as well. I did pop that link into the chat box so you can take a look if you want to look at that closer and add as we talk.
Yeah, and the nice thing is they're still active. So definitely feel like if you want to give anything a thumbs up or if you want to add to anything, that would be great. That again is from our first meeting. If you were unable to attend, I did go ahead and put your information and notes in there as well. If you had emailed me, but definitely take a look at it. We've gotten a ton of feedback. And again, the question was, what are your current workforce concerns in the healthcare industry?
So as I was perusing all of the answers this morning, what I found is we can bunch these answers into about 4 different categories. So as I look at it, based on what you've added here, and we, of course, this is a living and breathing document, so we can continue to add as we go. I see 4 main categories that kind of rose to the top. One of them being licensing and statutes issues. That kind of curtails like the point here at the top about it used to be for colleges that an RN halfway through their program could sit for the LPN board. Background challenges, we know that that's been an issue forever. Reimbursement issues, those type of things under that bucket. The second bucket, which seems to be the largest one, is education and training opportunities. So accessibility of programs across the state, especially in rural areas. Availability of entry-level talent, which kind of has a dotted line to the next category, which is workforce shortage. More specialized service providers available. Diversity, equity, and inclusion efforts to recruit populations into the field. Negative stereotypes and maybe some image work specifically was called out in this document around long-term care opportunities. And then more like promotion of that, of those opportunities that are available in the sector around career pathing and scholarships and training opportunities that are available for people to get their career started. The third bucket I saw is workforce shortage in labor, the lack of skilled labor and the lack of just people in general that we have to do the work. So some of these, like I said, have dotted lines to each other areas. So we just don't have enough people to do the work. We have barriers to people. So even though our unemployment is pretty much really close to what it was pre-pandemic, those that we have that are continuing to look for work might have more of those barriers. So how are we collectively looking at those barriers and building systems to create a bridge to get people through them? And then the fourth bucket that kind of rose to the top for me as I look through is around mental health. So we've got staff that have been working to the bone throughout this whole process. They're burnt out. And that again has a dotted line to the workforce shortage as well. And I saw on here kind of a theme of just post-traumatic stress from the result of COVID and working with patients during this process too. So those are the 4 buckets that I kind of saw, but I'm curious to see if anybody sees another bucket or wants to call out something that maybe wasn't highlighted as specifically as they would like it to be. or comments in general.
I'd like to add
Advices by
something.
anybody? Oh, go ahead.
Yeah, I think one of the things around the education and training is not just accessibility, availability, career pathing. I think it's also how do we contribute to educators, you know, because there is a shortage and we are turning, at least in Wisconsin, we are turning away nurses nationally as well because we don't have enough instructors and we don't pay them enough. So how do we, you know, how do we contribute to that as far as educators?
Okay, that's interesting. You know, I had another scenario that popped up since we met last. I'm working with a group of immigrants and refugees who would like to start their own business in southern Minnesota. And there are 15 people that are part of this group. And one of them has her RN. She just has not been able to pass boards, but she's motivated and she's smart and she's, you know, got all these things going for her. So I keep thinking about what about those people that just need extra supports, whether it's because of a language barrier or whether it's because they need somebody to help with certain things. You know, how are we supporting those people that have this immense amount of talent and training, but just can't get over that last hurdle? So just another thing to throw out there that I'm hearing more about as well.
Jessica, I was just going to comment to piggyback on the last comment about educators, that I think, you know, that is true. There's, first of all, a lack of educators, but then I think there's a lack of understanding in the educators we do have of how healthcare has changed. I think a lot of them haven't been out. You know, they've been in academia now for so long, they haven't been out and they haven't seen the changes. So we get people, you know, if you're going to come to a nursing home, it is a great challenge. It's a great opportunity. I mean, you're going to come in and probably be, as an RN, have maybe 25 patients that are under your care, maybe 10 staff people during your shift. So the fact that there is that broad array of experience needed doesn't seem to be there in the nursing schools. People are told more, well, you want to go to a hospital, you don't want to go to a nursing home, you're not going to really get any experience there. When, you know, we have extremely acute people, sometimes rehab people. So there's just a disconnect in what the jobs now are in nursing.
Wonderful.
Interesting. I'm taking notes too as you're talking there. So that whole concept of a gap, right, in needs and understanding, I'm wondering if others have had similar experiences with what they're seeing, and if anybody else would like to share. See some head noddings, but okay. So I'm going to add that as a category as well. Some maybe education gaps. I'll put that under education and training.
Excellent.
And I like that comment, Deb, about also misunderstanding about the patients across providers as well, and the vast variety of needs that your patients have.
Yeah, I don't know if the person from Care Providers could comment on that, of what the members of Care Providers say about that. And I'm leading age, but that's been a problem for us to have nurses come with a good understanding of what they're going to find.
Yeah, I think it also kind of marginalizes senior care a bit because people don't understand the complexity of the residents that we have. You know, even kind of at the legislative level, understanding that the people that we see in our settings come from acute care often. I mean, they're often the same patient, so the same level of complexity as far as, you know, a robust nursing experience or clinical experience. But then also layering on that mental health and behavioral health needs. And there's just such a high need for competency in those areas. The individuals that we see, are complex and do have multifaceted needs, and being someone who is nimble, in both mental health and behavioral health, in addition to having, good, solid clinical skills, it makes you very, very marketable. I mean, these are the people that may or may not be successful in a home environment, right? So it makes sense that these are the type of people that would be in our care. But I also think perpetuating some of those stereotypes kind of further marginalizes us, and people have these perceptions about what care is happening inside a nursing home. One of the things that we've experienced, or that we're going to experience, is outreach by educators through educator externships, where they're going to actually come in to one of our facilities and get kind of a firsthand look on, what is it that we're providing in this setting? Because I think there's also misperceptions about the levels that, within the care continuum. Everybody just says nursing home, and they don't really know what exists, what the nuances are for specialties, and what the actual differences are legally by setting. But, having an opportunity to engage with an educator, I think, is huge. I think you said it, that having firsthand knowledge of the types of residents and the types of clients that we're caring for, it is critical to informing, what experiences they're giving their students.
Well said.
Yeah, and it's an issue, I think, not just at long-term care. I know long-term care has concerns and issues, but we want to keep it, big picture as well on all healthcare and all different fields in the healthcare industry. But I definitely feel your pain. I worked in nursing home facilities and completely understand that there is a stigma, and how do we help with that?
And I think with COVID, understanding that, what public health is and how all healthcare entities are interrelated, and that we have this full-on continuum. And if you put the person at the center of that, it really is about providing whatever and giving that person whatever they need in that moment. But understanding that interrelationship, I think, is critical, so that we know how we impact each other.
Wonderful. Very good point. Okay, I think we're going to move on to the next Padlet. Jess, if you want to pull that one up.
Yes. So did my screen share it to the next?
It did.
Okay. Hey, that is great news. All right. So this one was focused on how your organization, schools, colleges, and or communities are developing stronger talent pipelines in healthcare. How could they? So, let me send you that link too here. So a couple things stood out for me in this one. I'm going to pop the link in here. See how many things I can do at once. Okay. So that should be in the chat there. So some things that stood out for me here in this one, it looks like it's 3 different buckets to me. And again, this is a living, breathing document that we can change and grow as we go through. So I see 3 different categories of engagement. One being youth, and how are we engaging with youth now, and how we can do that better through offering a variety of career exploration tools or interest inventories for them to kind of search through and see what exactly what area they might be interested in. I think of Scrubs Camp that's happening across the state, or in my area happened a month or so ago, and Della had one and Sean had one. So where kids get a firsthand experience to a variety of different careers in healthcare. The other one that stood out to me here was a purposeful connection with youth. So making that a priority and on purpose, and how are we making those engagements really solid and meaningful for youth? And that could be going into the schools, having those job shadow opportunities for youth, bringing students into your facility to give them a firsthand, or going into the classroom and doing presentations. The second bucket I see is community engagement. So how are providers engaging in your communities, interacting with other providers, employee networking or employer networking opportunities. So I see a lot of a desire for sharing experiences and asking each other questions. I'm seeing that a lot where people are like, okay, how are you doing this and how are you managing that? So all providers have that opportunity to have somebody who knows what's going on in their world and be engaged and with it and in it with them. And then you know, just opportunities to share, like this particular group where you can get together and kind of hear what's going on and share best practices and kind of put your heads together and solve the real problem, right? Because you can get people like Della, Sean, and I from the state, and you can get other partners within the communities who want to help, and we can go in there and start all these initiatives. But if we do not have you along with us, we could be solving a problem that's not even the problem that you think is the most important. So being engaged in these groups is so important for us and for you. And then the third bucket I saw kind of rose to the top was around education. And this seems to be the largest bucket in this particular group, again, with those dotted lines to youth and community engagement. So creative partnerships between providers and education. I see a lot of that in these comments where providers and education both, you know, I want to get connected to providers, and our providers are saying, I really want to get connected to education, and we don't always know how to make that happen. And this is a perfect opportunity to do that. More nursing assistant classes, again, under that education bucket, community discussions, and then shared training programs. So how can providers collaborate to provide that maybe basic level of training and share the cost, and then have a really strong workforce, understanding and knowing that sometimes you're just training your workforce to go be somebody else's workforce, but knowing that's just kind of how things are right now. And at least you know that people are getting this same basic quality training that's out there. So those are some of the things that I see as being the three buckets and themes, but I'm interested to hear what you think, and if there are other things that you either want to add or highlight based on what you're seeing on the screen here, or based on what you're experiencing if you weren't able to add anything.
Well, one of the things that and it's probably contained in here, but I just think that there's such a huge value to working in healthcare as a student. And students are so focused on getting volunteer hours and having a good resume prior to entry into college. And that's not everybody's career path or life journey. I totally understand that. But I think that it's a missed opportunity to sell our profession as this kind of place that, and it's kind of akin to what you have on the first bucket there, but this place where you can develop, where you can learn. And I'm not just talking about simple clinical skills. I'm talking about life skills, job skills, well-rounded skills to make you a good employee in the future, to be successful. I just think healthcare offers that. Really, any setting offers you the ability to interact with people in a way that you don't get in other industries. And I think that that's a missed opportunity for us.
I like that idea of using healthcare as a starter job, and what better opportunity to build in communication skills, leadership skills, that sense of empathy and work ethic. And those are things that all of our employers across sectors are saying loud and clear that they really need. Problem solving skills. So I like that thought. Thank you for sharing.
This is Colleen Brickle from Normandale.
I don't know.
Oops.
Go ahead.
Go ahead.
Oh, Okay, I'll go ahead. Sorry. I was just thinking, that I like the stronger, develop stronger college and employer communication. But I'm almost wondering now, Sherry's on here, but I think even a stronger would be even with the system. Because being on the campuses, I'm just going to give an example. I've been on a group that's met 50 times and the Commissioner of Health was on it, or Commissioner of Department of Human Services on Friday. And of course, the needs of dental assistants and dental hygienists right now is off the roof too. And one of the things the commissioner said to me in front of, and the U was on there, it's a group of safety net providers. We need your help. We'll be coming to you too. This was the commissioner. So I know that's out there, but what I'm thinking too, I kept thinking, well, I really wish the commissioner would go to our system, because the campus is just for them to hear too, as Sherry maybe would back me up, we can only do so much with space and talent, and what can they do to help drive that, and even the legislature, because we sure want to, especially, it's just so different with enrollment trends and everything right now. This is sort of a new era for the universities and colleges in the system.
Good thoughts there. I'm going to go back and listen to that in the recording again, because I really want to get a clear picture of the full idea of what you've got there. Because I think it's really important. I like that concept of, the system as a whole. So how can we branch that out a little bit? Thank you for sharing, Colleen.
Deb Barnes, you had your hand raised. I don't know if it was from prior or if you had something else you wanted to add.
Sorry, I should take it up. Yeah, I was just going to add just something our chamber is doing right now. We have a really large, successful area career exploration event at the high school every year. And so the chamber right now is actually taking that event and developing a website. And so every employer, and there are hundreds, will have a video shot, and then they're going to, all of the infographics will be on that site as well. So I was just throwing that out there. I know a lot of areas have the area career exploration. So the chamber is taking it one step further and developing a website that will be easy to see. And then the kids can go back and say, okay, I didn't get to see these two. I wonder what they were. And so it will be an ongoing website. So I thought I'm very impressed that they're doing that. I think it's a good idea.
That's great.
I like that, Deb.
Yeah, and Bridges Academy in Brainerd area, it has a really successful program as well. And from that, then St. Cloud also has Exploring Potential Interests and Careers event that they do every year too, that focuses on all careers, but healthcare obviously plays a huge part in that. So very successful hands-on activities and events for students. And now it also is programs throughout the year at the school districts as well, that they learn more about career opportunities. Excellent. I think we're going to move on then, Jess, to our new Padlets for this month. I don't know if you want to pull one of those up and we can kind of start conversation on those as well.
Sure. And I will get the link popped in here now.
So from the conversation and some of the information that had popped up, we thought, what kind of gaps in training and certifications and degrees are you currently experiencing? And this is a live document. You can definitely go on to the link that Jess is posting and put your comments in there. Where do you feel those, which certifications? Obviously, we hear a lot about CNAs. Is that the real focus, or what other areas do we feel that there's some issues and concerns? And you guys can just kind of name them off too, and we can type them in there as well.
Licensed practical nurses, ever since they restructured the RN programs so that they couldn't do the test out halfway through.
Okay, so LPNs, is that at the 1 to 2 year, or is that a 4 year?
Well, it's a 1 year.
Okay, so 1 year LPN.
Yeah, so used to, when they took the RN program, about halfway through, depending on how it was structured, they would be able to take their LPN boards halfway through their RN program. And a lot of the colleges have restructured their RN programming, and it's not, they can't take their LPNs anymore. So it's all or nothing. So that's created a shortage with the LPN. You know, we don't have as many LPNs because at least there were working LPNs out there that were still in school to get their RN.
And when did that change, Shayla?
I would want to say probably about 4 years ago.
Mm-hmm. And Paul just asked a question, you know, to clarify on gaps. I guess that's anybody that you're trying to hire, people who don't have the degree. Also, you know, the certification time. Are you hearing that potential hires or job seekers or people internally are having issues even getting into programs? There's not enough programs available. I guess gaps could be anything from, you know, trying to hire for those positions all the way through to, you know, are there not enough classes being offered?
Can someone confirm, is respiratory therapy, would that be a 2-year or a 4-year?
2.
That's 2.
Just wanted to make sure. Oh, somebody has it on here.
We have quite a few in that 1 to 2 year. That's really interesting. So RNs, is that as hard to fill those positions? Is that easier?
It's hard. I would add that in there for 2 and 4 year.
Okay, so there's a 2-year degree for RNs as well as 4-year?
Yep.
Can I make a comment on that?
Yeah.
Going back to connecting the dots with the last one.
You froze, Cindy.
Ooh, community health workers, that's a good one.
Mm-hmm. How about medical assistants?
There, she's back.
Cindy, it might help if you shut your camera off. That might help your Wi-Fi.
Yeah, I'm
And
sorry.
then you'll
I've
be able
tried
to
everything
talk.
else. Yeah. Okay, so a critical pipeline for us, and there is a gap, is in the RNs, is to be able to have traveling nurses. And the state makes it a little more difficult, is what we're trying to understand here, to try to get people and vendors into the program. There's a pay, like I think it's a $5,000 fee to get into it, and people don't opt in terms of vendors. So I think that's a serious problem, especially the heavy reliance because of the shortage and with the pandemic. So I'd like to add that as our list of opportunities. I didn't get to mention it at the last round, but I think that's critical for RNs at the minimum.
And when you say traveling, is it within your region, throughout the state?
This is contingent staffing through a managed service provider, an MSP, who to get nurses to come for a period of time to work at our sites. And I think international nursing is something we need to explore. And how do we make that easier? The shortages are extreme across the nation for nurses. 53,000, I believe, is the shortage right now, and it's only growing. So I think we have to look at creatively, not just building our own from within the pipelines we have. It won't be enough. Yes, and we need this, and we need that.
I'm seeing the sterile processing techs. That's coming up a lot as in the biomed field, especially in the Southeast region.
Mm-hmm.
It seems to be coming up. What about like dietary for this entry-level certificate? Is that a need?
Certified dietary managers, there's not even a CDM program. Is there in Minnesota?
Yeah, there is one, but there's not enough of them.
Yeah, there's not enough of them. Yes, there's not enough of them. There's not enough CDMs for sure.
And that's that manager. So what, can you educate me here on what level that is?
It's a certificate.
Is it? Okay.
Yeah.
And it's required for all licensed nursing facilities.
Okay.
Yeah, at St. Luke's, we struggle to hire dietary staff, but in their entry level, they just need a high school diploma.
Are we seeing any other shortages over here for the advanced degrees? I have been hearing the mental health practitioners, and even, you know, even in our area in southern Minnesota, most of them are booked out like 6 months. So in a time
Yeah,
where
same.
people are needed.
We struggle to find like doctorate level psychologists and licensed social workers and independent social workers. So yeah, it's within that area.
Is that because there isn't enough people graduating in those programs? Is it because of high burnout in those positions?
That's a good question. I mean, I think a lot of it is just a shortage in people that are qualified. We typically don't really receive many applicants at all. And so I don't know if anyone else has anything to add to that, but I know they, like the independent social workers, have like X amount of hours they need to complete after finishing school. And so I think it's just a longer process and just harder to find people going into that.
Excellent. We hear a lot of burnout in that career and safety issues. Is that, are we off when we hear those kind of things? Or is that something that you guys hear as well in your field?
Yeah, we hear it. I mean, I think a lot of people through COVID, you know, retired early or left the workforce. But yeah, I mean, I definitely feel like our volumes are not what we expected at this point. So it's still very busy.
Sure. I think it always will be. I think that's definitely a growing field, especially with mental health.
Agreed.
Excellent. So we have a lot of those 1 to 2 years. That kind of seems where the concern, or is that a bottleneck? Is that because there's not enough people going into those positions? Is there not enough classes being offered? What are your guys' opinions on that?
Everyone's either just skipping straight to the 2 and 4 year degrees, or they're just getting a certificate and they just kind of stay there. That's just what I noticed. For the most part, people would get in and they would stay 5, 6, 7 years and wouldn't go anywhere else or get another degree or certificate. I think it seems to be no one's enrolling for the most part in the middle, in the first part.
How about somebody from the state colleges? Would they have any input or information on that? On how full your classes are for those that are listed? Anybody?
Yeah, we would really love to see that data if it exists, because we're trying to capture what is the availability of the talent. We're seeing just the opposite. We're seeing that we have so much competition for the entry level roles that they're being, from retail to food restaurant to Amazon to, the future of, coming into those markets. EVS and food is another area where we can't find people. So, it's so much, the training is extensive to go into EVS or food, and compared to, bar restaurant where you get tips and whatnot. So we're finding that as well. It's across the board.
I also think there's this kind of perfect storm, right? In that you have some people that aren't necessarily working and laddering up from the very bottom. They're trying to obtain that 2-year degree and maybe not working while they're doing so. which has impact. If you don't have people that start at a certificate level and then go up, it impacts your, and we're also, we just have such volatility in the market where we're competing at the entry level with every industry. And we also need to face high levels of turnover. Healthcare has higher levels of turnover than other industries. I don't know about now because, it's the great resignation and lots of people are leaving, but I think that's something that we need to face as well.
So are they leaving the industry or are they just going to a new field within healthcare?
Lots of people have indicated that in senior care that they just leave for another senior care entity. I don't know that we have good data to really quantify that story. And because the labor market is evolving so rapidly right now, I really don't think that we have good data about today.
Thank you. Sherry said that she's going to dig into the enrollment in some of these programs. I'll also talk to our labor market analysts as well to see if we can get a little bit more data on that. Just to kind of see, is it because we're not offering enough classes or are they not available or full? Kind of to see where that is. But it seems, if we go through these respiratory therapy, are you guys all hurting for that position? If we go through these one by one, I think you're going to see that, it's quite redundant. So I think when we make this link available to you or you go on there, if you guys could even just put a thumbs up or a heart or, kind of like voting on them, just adding your 2 cents to the ones that are already in there or add others as well, then we'll have a better idea of the need as well. So definitely take the time to do that. We'll make sure after the meeting that we send that to you as well. I think we're going to move on, Jessica, to the final Padlet.
Did it change again?
It did. Magic.
Yay. All right. I'm getting this down after way too long, right? Okay. So you can see we're starting to figure out, we're laying the foundation for where we need to go trajectory, right? So now we want to look at what is working. We want to start shifting into the positive. So what is working? And I'm hoping that we can take just a few minutes here to share what are some successful marketing and recruitment models that you've developed or heard about to build a talent pipeline at your organization. And they can be examples like that great example that Deb gave regarding how the chamber is engaging with youth differently by creating that website for the career exploration opportunities. That can be a living and breathing document that they can access as many times as they want. We're just looking for kind of to create this database of best practices that you all will have access to so that you can replicate them if you choose to. So again, just as a reminder, you would use this button down in the bottom right hand to create a tile that you can add information to.
Yeah, and if you want to put anything in the chat as well, Jess has done a great job just kind of adding them in there too if you don't want to or can't open the link. Definitely feel free, or if you just want to rattle some off, that would be great too.
Yep, I'll try to see how fast I can be. Maybe Sean can help me if it gets too many.
Scrubs Camp, I would say those programs through the schools as well, like Epic and Bridges. And what's the one called in your region, Jess?
We have Navigator, we have Career Expos, we have a variety of different opportunities.
Right.
Mm-hmm.
Perfect.
So I'll just kind of link some of those together.
Good. How about apprenticeships? Have you guys done any type of apprenticeship programs? Gotten any sort of funding for apprenticeship programs? Done any type of mentoring programs internally? How about cross-training your people? Moving people into different departments?
My region has had success utilizing the pipeline program for CNAs to move up. So if you are not aware of that program, we can pop a link in for you.
This is Colleen. Yeah, I noticed the pipeline this year from in the cities, community health workers. We're going to be having some students, a dental hygienist who use the pipe. So I think, you know, that is starting to take hold. I don't know if this is one, but I keep thinking it's a successful marketing enrollment. Even at a community college, it's really the concurrent enrollment. You know, we have some really good programs, but what we're finding a little bit, some of the districts are running into financial problems and not able to help support that. So that's kind of a new challenge, but concurrent enrollment is one.
So this is Deb. Again, it's not that we've developed, but both associations for long-term care with the legislature, we have, and we advertise this nonstop, that you can come here and we have to cash flow your schooling, but there are two opportunities you can do, and we then are reimbursed through our rates from the legislature, from DHS. So it's magnificent. And so someone may start out, for us, we can pay for their entire tuition. And then hopefully they work for us, but that's not even a requirement. The legislature just is providing this so that there will be another nurse in the state somewhere. So hopefully they stay with us and work, but we can cash flow their tuition, or we can have somebody come in the door and then we can do it after the fact. We can pay them for the tuition payments that they're paying. So this is all reimbursed to us in long-term care. But the thing is, you know, even if people start here, because this is a great program, they can get their school paid. They work for us for a couple of years, then they go on to a hospital or a clinic, whatever other entity. You know, so we've had them for a while, they go on, but it's a great, great program, and it's somewhat of a secret. But if people start out in long-term care, basically they can get their nursing education paid.
That's great.
I like it. Brent, I like your comment out there too. There's a program in the St. Cloud area. It's called Career One. They work with youth that I don't want to say that they're at risk, but maybe they have, maybe they're on some sort of needs program, SNAP, or any type of lower reading levels. It could be English as a second language. It's one of the only programs, summer camp programs, that these students are actually paid to attend, and they teach them about volunteering and being part of the community and getting their first job and writing that resume. I know CentraCare does a great job. They're hugely funded. That group is hugely funded by CentraCare. So not only being involved, but also, you know, putting some money into those programs to make sure that they're successful and building that talent pipeline. Jenny, I don't know if you're still on from Good Shepherd. Do you want to talk at all about your program that you offer with the free nursing, free CNA programs that you offer on site?
I think she just had to step off. I think she's the one that just had to leave.
Well, I kind of just summarized it, but what they do is they advertise throughout the community their free CNA education opportunities. There's no cost to the person. A lot of times too, if they're working at the company, they're actually paid to attend that training. So there's no, you know, a lot of times, you know, you can say, yeah, we'll reimburse you for your CNA licensure once you get it. A lot of people don't have that money available to even take that CNA. So how do we make that a little easier for them to participate and get that type of certification? Great. I see HOSA's on here, which is a high school program. Thanks for bringing that up, Sean. And then I don't know, are any of you members of HHRAM? That's a healthcare group for HR. They're pretty active in the St. Cloud area. So different types of SHRM is another big group. You know, different types of organizations within the community that you guys can share and ask those type of questions or concerns that you have. How about diversity? We really haven't dug into that a lot. What kind of recruiting and marketing are you doing to diversify your workforce? You know, just like those car ads or those Dairy Queen ads or whatever ad on TV, you know, they market to different people. So if you're just running that one ad all the time, you're probably not getting the same sort of response. I know in the St. Cloud area, we do have a Somali radio station, and that has been very successful for employers to have ads run directly on that Somali radio station and recruiting to, you know, to that population. Anybody work with the group CLUES, CLUES? It's an acronym. It's for, it's a Hispanic group. So unfortunately, I cannot pronounce what that is. And so I always just use the acronym. But they work in different communities, helping the Hispanic and Spanish speaking people with learning the language as well as getting that first job. In Wilmer, we've run different programs where for them to become CNAs, we work specifically on terminology and making sure that they understand, you know, what that job is. And that program has been very successful in Wilmer. How about at schools, high schools, colleges? What's something outside of the box that you've done?
Avivo is a kind of social organization, and they do customized kind of job placement where they're willing to fund whatever the individual is interested in, but had some success with them funding healthcare careers, specifically nursing assistant. They will do anything, but it's a person-centered approach to getting the person started, and they focus on homeless youth. So it's kind of like a holistic approach.
And Jessica, it's AVIVO.
Thank you.
You bet. No E. Perfect.
Oh, yeah, that looks right.
Excellent. Well, what we're going to do is we're going to share these documents again. We're going to keep them live. We want you guys to definitely use this as a sounding board. We have about a minute left. Where do we want to go from here? We talked about following up with the labor market analysts and following up with the colleges to see about enrollment and the number of positions that they offer for certain degrees, asking if those programs are full and how many that actually graduate per year. What other questions or things do we want to follow up with? And then the next question would be, do we want to meet again next month?
I'll weigh in. I absolutely want to meet next month. I think just looking in the comments, people are very happy with this process. And I think the end in mind, I guess, we could try to crystallize that a little bit more, maybe, Della, you know, at the end of, you know, what would we all like to get out of this committee? I think this sharing is fantastic. It's a great start. Do we want to prioritize certain things that we can really have an impact on would be probably a good next step in my eyes.
I like that, Cindy. Thank you.
Mm-hmm.
So really starting to prioritize and focusing in a little more. I really like that.
I think the next meeting, Della, I think a great start to get on that path would be to have Luke come in and talk about the data he has regarding youth, and then have, if Sherry's got information by then about what enrollment looks like in these programs, I think that would be a great way to start framing where to go from there.
I like it. So we'll get that set up for our next meeting. If you guys want to quickly look at your calendars, I apologize, we're over by a minute, but how about the week of August 16th? We could look at that Monday or Tuesday. And we could look at that 11 a.m. time frame again. Does that work for you guys? Nobody's gone on vacation? Nobody's running away from home?
Tuesday's probably better. We have an all-day orientation. This is Colleen on the 16th, but Tuesday the 17th looks better for me.
Wonderful. So we'll aim for August 17th at 11 a.m. Does that work for everybody?
Yep.
Great. I'll go ahead and get that invite out. We'll have Luke come in, talk a little bit more about that youth data and some of those programs that are available, and then we'll cross-reference that with the colleges and the programs that are being offered and graduation, etc. Great. Thank you, everybody. Thanks for staying a couple of minutes late. And
Thank
hope you
you.
enjoy your lunch.
Thank you.
Bye, everyone.
Bye.
Jessica and Sean, you want to stay on?